Okay, so I just saw you in the office today or probably yesterday, and we went through the whole procedure. You probably didn't hear a word I said after I mentioned operation. So you're probably like most patients, and you can't quite remember what we went over, what to do, and what to expect. You have family members who are asking you questions, and you don't have answers for them. So my hope with this video is that I can kind of recap some of the most important things that we would have discussed. That way you can refer to this, you can share it with your family, and this might make the whole experience a lot easier. So a couple things. Prior to your operation, at least 8 hours before your surgery, you need to make sure that you stop eating. So if you're the first early case, nothing to eat or drink after midnight. Second, somebody does need to be with you during the operation, so you cannot drive yourself home. Even if it's only going to be an IV sedation, somebody has to drive you. Next, you got to refer to the packet. So I know Will went over your consent. He also gave you this packet of information, so please refer to it. This has a lot of this information contained within it. Common questions include, what medication should I stop? The big thing is any anti-inflammatory medications that may thin your blood. Please discontinue those at least a week prior to your operation. There is an entire list of medications that should be stopped prior to the surgery as well in your packet. Oftentimes patients are very concerned about when their surgery is going to be, and we may have specifically addressed it, especially if you're a more urgent patient with a fracture that may need to be fixed right away. But otherwise, Sky, who does my surgical scheduling, will be in touch with you usually in about 7 days. Now her information is also in the packet, phone number and email, and the email is going to be your best method of contact. But she will be in touch with you. She'll have information regarding your benefits. She'll let you know if there's any co-insurance that may be your responsibility, and then you guys will be able to work out a date and location. Also, with respect to any blood work that you may or may not have to have done. So if you were given a prescription for blood work or an EKG, and you've already had blood work done maybe within a month or so, we can utilize that, but you've got to get it sent over to us. Also, EKGs are acceptable within 6 months. If you haven't had that and you have the prescription, then you need to have those done and sent back to us before we can schedule your operation. So please make sure that you get that information sent to us, and make sure you confirm that we've actually received it. Many times the primary care physician or whoever may have it may have told you it was sent when in fact we have not received it. So please follow up with Sky via email to make sure that we have received all the information that we need. Again, our hope here is to take the very best care of you, take a lot of the anxiety out of this situation, and have you go through the best possible surgical experience we can offer. So if you have any questions, please don't hesitate to contact us, and I promise you I'll do my very best to make this experience as simple as possible.